This video is made for TSW sufferers who are seeking acupuncture wherever they are in the world. My name is Dr. Mark. I am based in Singapore and I am a medically trained TCM. I have over 10 years of treating TSW here in Singapore. I've seen many thousands of TSW patients in the last 10 years. Acupuncture is able to provide relief for relentless symptoms like burning on the skin, itching, and sometimes oozing on the skin. So depending on what kind of skin situation you have, we have a different method for it. For more on this, listen on. Why is acupuncture helpful for TSW? I will list 3 reasons. The first reason is because it can help regulate the central nervous system. Any kind of mental stress will show up as fight or flight in the central nervous system. TSW patients undergo tremendous mental stress. This is because the itch is so intense, but at the same time, they're trying their very best not to scratch. It is very difficult and will inevitably bring up the fight or flight, which further aggravates the situation. Acupuncture helps to calm down the fight or flight. The second reason is because it is able to help reduce systemic inflammation. If you go to an acupuncturist where you are and you use common acupuncture points, and some of them are like this, and some others on the rest of the body, it does help reduce inflammation overall. The third reason is because acupuncture can help lessen the effects of TSW. TSW causes intense inflammation, disrupted blood flow, and very intense itch. All this ends up as a vicious and debilitating itch-scratch cycle. You itch, you want to scratch, and the skin gets worse and it itches. And we do not want this to cycle out of control. Rather, we want to lessen the inflammation so the skin has time to heal. Next, I'll talk about 5 acupuncture points if you have a skin situation. These 5 points apply when you have eczema. They also apply when you have TSW. The first point is Qi Chi or Li11. It is good for reducing inflammation. Qi Chi is often used with He Gu, which is Li4, especially if it pertains to the head and the face. The next acupuncture point is Tai Cong, Li3. Tai Cong is almost always used together with He Gu, and this is to help clear liver qi stagnation, reduce stress, and calm the system a bit. And then there is San Yin Jiao. San Yin Jiao is somewhere near the inner ankles, and it is good for regulating the immune system. Lastly, there's Yin Tang between the 2 eyebrows. This is also good for calming the nervous system. Remember we mentioned earlier that acupuncture is good for regulating the central nervous system? All these points are good, and all these points help the entire system. For TSW, you need more than that. Regular acupuncture points can help calm the body, they can reduce inflammation at the systemic level, but they are not as useful when targeting local lesions. And in TSW, local lesions are everywhere. Everywhere is red. If you have full body red skin syndrome, a lot of it from the face down to the arms, and some of you just the lower limbs alone. But my point is this: wherever there are lesions, these lesions should be needled. Wherever there is inflammation, we should be needling it. And these are at the level of the epidermis and the dermis. For this reason, we needle right on the skin itself and we don't go any deeper. The 2 types of needling. The first type of needling is scattered needling. Scattered needling works well for erythemas, which is red patches. In scattering needles, you are just putting at a certain density needles around the area that is red. The second type of needling is called surround the dragon. All the acupuncturists understand, and they are most suitable for discoid lesions. Discoid lesions are like craters that are oozing fluid, and you'll be needling around that crater. Of course, craters do coalesce and converge together to become one big patch, and in those cases, you'll be needling around the patch. In this next section, we'll be talking about how to do the microneedling. I emphasize again, in microneedling, we are doing direct needling on the lesion. We are needling where there is inflammation. Contrary to what you might think, putting needles where the lesions are going to help the skin. This is a concept of microtrauma eliciting the body's own defenses, where microtrauma actually helps the body. By putting a needle in a location, the skin responds with anti-inflammatory effect. Sometimes, as quickly as during that acupuncture session, we can see redness reduced significantly. Reduction of itch is most always a bonus. If you're lucky, you do get reduction of itch. Some of my patients put a needle and they have reduced itch by at least 80% for 5 days, and that is huge. Every patient responds differently. So it is always important to monitor and ask the patient to feedback how they respond to the acupuncture. Always start slow if you are a patient who is new to this, or if you're an acupuncturist who is doing this for the first time. If a patient comes in, whole body RSS, red skin syndrome, you could patch test first. Maybe just put needles here and the patient will have feedback for you. within half a day, and you will know whether it makes sense to do the whole body. Intensity negotiation. How intense should a session be? This always applies in acupuncture, whether you're trying to solve a musculoskeletal issue or whether you're doing a TSW treatment. If in one area of the body, say the forearm, you put 10 needles, that is less intense than if you put 15 needles. 15 needles would mean more concentration. Sometimes some bodies are more sensitive and cannot do with too intense treatment. In this case, you can always start slow and do less needles first. Usually, if the patient responds well, they may ask for something a little more intense. What to expect? Some people have zero response. The people I've seen with zero response are usually those on immunosuppressants like cyclosporin. If this was zero intensity and this was intensity of 10, a good response is if a person is at a 10, you bring them down to a 5 and they stay at a 5 for 5 to 7 days. And that's considered a good response. A not so good response is you bring a person from a 10 to an 8 and it only lasts 1 day. You want both a good drop in severity and you want a long enough duration of effect, because this is going to drag out that itch scratch cycle, which means your skin has more time to heal. In our clinic, we do it once a week. Say your duration of good effect is 5 days. Usually the extra 2 days in that week, if you don't get acupuncture, you may start feeling the flare building up minorly. It's okay, because the next time you get acupuncture again, the skin's going to feel better. The ultimate goal in using acupuncture is to reduce inflammation so that the body can do its thing. This means that previously you would scratch an area and it would ooze. After several rounds of acupuncture, you may scratch an area and you're going to find that, hey, the skin's more resilient. It's a little more like normal skin. I hope that my sharing is useful for you as a patient, because you can bring it to your acupuncturist. And if you're an acupuncturist, I hope this method will come in handy for you if you are seeing a TSW patient. Ultimately, we all want to heal, and I wish you a gradual and sustainable recovery. Any questions? Leave comments below. I'm happy to answer. Thank you.